So we've had to use Near Me in a whole variety of different ways during the pandemic, and have adapted how we can perhaps start to use it now we're coming out of the pandemic. One really quite interesting and quite successful case was a gentleman with Parkinson's disease who I saw with his wife in their own home. They had good lighting, good conditions, good internet connection. And actually, I was able to take the history really very well from him. His condition, Parkinson's disease, is quite easily visible when you're doing a video, and some of the examination findings can be done relatively straightforwardly, particularly if they're not too subtle findings by a relative. His wife, who was very able to obey instructions and help, managed to undertake the examination relatively well, and we were able to make quite a positive diagnosis of his condition and provide advice. This actually worked as well as a face-to-face case, but it was under ideal conditions. There are challenges, and there are often quite individual challenges which come up differently at different times. But a number of the ones that do come up are perhaps sometimes there is a delay in the sound, and so you have to be quite careful about that and adapt to that when it does happen. One useful way of managing that is to use a mobile telephone either end and use the speaker and to mute the Near Me either end, and that can actually work quite well and take away a lot of the difficulties with the sound. Sometimes there can be video difficulties, and it often depends on the patient's broadband connection. The main way of dealing with that, if it is a problem, is to revert to the telephone, and that is something you have to do for some people. So it will have to happen for some people on Near Me consultations, and you can then plan for the next one depending on what happens. So in Grampian, we have quite a wide geographical area, and we cover patients from Orkney and from Shetland. I've got a few fairly straightforward examples. One was a gentleman with motor neuron disease who was being assessed at the Balfour Hospital, and it was much easier to assess him using video than it was providing advice to the junior doctor by telephone. So we were able to quite successfully set up a video link so I could assess the patient properly and provide adequate advice that helped with his management. So that's one way of doing it. Another quite useful one was a young lady with epilepsy who lives in a care home, and I was able to bring in her with her carer, her father on a different screen, the learning disability nurse on a different screen, and the epilepsy nurse on a different screen. And so we had a 5-way conversation that really was quite instrumental in her management. And that's quite another useful way of undertaking consultations where it does improve access. And in that situation, it's been quite difficult to get everybody together in one place, particularly given that the young lady lives on an island. And maybe the final one was a lady who needed a fairly quick assessment, again with motor neuron disease, but needed prompt advice, and we were able to set that up with the GP practice. The GP was there in the clinic room with the patient and her relative, and again we were able to provide a good management plan with everybody required involved.